My name is Jessica Bankston, and my presentation is over coronary heart disease. I'm going to tell you about the disease, strategies to treat it, and where it is found to have the highest rates. Coronary heart disease, also known as coronary artery disease, is a disease in which a waxy substance called plaque builds up inside of coronary arteries. These arteries supply oxygen-rich blood to your heart muscle. If the flow of oxygen-rich blood to your heart muscle is reduced or blocked, a heart attack can occur. Over time, coronary heart disease can weaken heart muscle and lead to heart failure. According to a study of prediction of coronary heart disease using risk factor categories, recommended guidelines of blood pressure, total cholesterol, and LDL cholesterol effectively predicted coronary heart disease in a middle-aged white population sample. Warfarin is an anticoagulant. It prevents blood clot formation and their migration in the body. Warfarin was approved for use as medication in 1954 and is the most widely prescribed oral anticoagulant drug in North America. Warfarin decreases blood coagulation by inhibiting vitamin K epoxide reductase, an enzyme that recycles oxidized vitamin K to its reduced form. Despite its effectiveness, its activity must be monitored by blood tests because warfarin interacts with many commonly used medications and some foods, especially those with large amounts of vitamin K. Metoprolol is a beta blocker that prevents angina and reduces high blood pressure. Angina is chest pain caused by your heart when it doesn't get enough oxygen-rich blood. Metoprolol works by decreasing the heart rate, contractility, and cardiac output, therefore decreasing your blood pressure. It can be prescribed as tartrate or succinate, respectively an immediate-release or extended-release metoprolol. It is also prescribed for off-label use in anxiety disorders. You should never abruptly stop taking metoprolol as it can rapidly increase your heart rate and blood pressure. Amlodipine is a long-acting calcium channel blocker that relaxes the smooth muscle in the arterial wall, decreasing the total peripheral resistance, thereby decreasing blood pressure. The contractile processes of cardiac muscle and vascular smooth muscle are dependent upon the movement of extracellular calcium ions into cells through specific ion channels. Amlodipine can produce side effects such as dizziness, depression, insomnia, and muscle, stomach, or headaches. Amlodipine can be prescribed alone or in combination with a beta blocker. The highest rates of coronary heart disease are found in Central Asia, including the countries Belarus, Ukraine, Turkmenistan, Uzbekistan, Kazakhstan, Kyrgyzstan, and Afghanistan. I will focus on Turkmenistan and Kazakhstan, comparing and contrasting several aspects of each country. Turkmenistan and Kazakhstan differ in several ways. Turkmenistan is only slightly larger than California, filled with sandy deserts and a few mountains along the border. On the other hand, Kazakhstan is slightly less than 4 times the size of Texas. There are vast steppes in the west, mountains in the east, plains in the north, and deserts in the south. Kazakhstan also has natural hazards such as earthquakes and mudslides. Both countries have the same literacy rate that children of 15 years and over can read. Also, they both achieved independence from the Soviet Union in 1991. Turkmenistan defines itself as a secular democracy and a presidential republic. Their 2 largest crops are cotton and wheat. Cotton is produced mostly for export, while most of the wheat is domestically consumed. Although agriculture only accounts for 8% of GDP, it employs nearly half of the country's workforce. Exports to China, Ukraine, and Italy include gas, crude oil, petrochemicals, textiles, and cotton fiber. Imports Turkmenistan receives includes machinery, equipment, and chemicals. The monetary value of Turkmenistan's exports and imports differs greatly when comparing them to Kazakhstan. Kazakhstan has an advantage because they are a much larger country. They receive roughly $78 billion more from exports than Turkmenistan. Kazakhstan exports oil, oil products, natural gas, ferrous metals, chemicals, machinery, grain, wool, and meat. Kazakhstan has enormous fossil fuel reserves and other minerals and metals such as uranium, copper, and zinc. It also has a large agriculture sector featuring grain and livestock. Landlocked, Kazakhstan relies on its neighbors to export its products. A country's health can be affected by several factors, including environmental issues, lifestyle, and diet. Turkmenistan and Kazakhstan both experience environmental issues such as contamination of soil from agricultural chemicals. Coronary heart disease is higher in these countries because of the poor quality of medical care and poor treatment quality in hospitals. A study done by P. McGee confirmed that rates of coronary heart disease are higher in South Asians. They have excess risks that result from metabolic disturbances associated with insulin resistance. It is also said that psychosocial factors may play a small role. They are low-income countries living under oppressive regimes. Turkmenistan and Kazakhstan both lead unhealthy lifestyles. According to an article in the Journal of the American Medical Association, diets using non-hydrogenated, unsaturated fats is the predominant form of dietary fat. Whole grains is the main form of carbohydrates. An abundance of fruits and vegetables and adequate omega-3 fatty acids can offer significant protection against coronary heart disease. I hope you've become more familiar with what coronary heart disease is. It is caused by the buildup of plaque inside the coronary arteries. Drugs such as anticoagulants, beta blockers, and calcium channel blockers are taken for this disease. Your diet has a major impact on you, so remember to eat right and live a healthy lifestyle.